South Dakota saw a 2-month high in hospitalizations this week.
While the number of people hospitalized leveled off a little bit today, the state's hospitals tell us that admitted patients are younger and a majority are unvaccinated.
In tonight's edition of COVID-19 Beyond the Numbers, we have the story of a 46-year-old Sioux Falls man who recently was hospitalized for COVID-19 pneumonia. Ryan Oakes is back on the job as manager of Mini Critters Pet Store in Sioux Falls. When he started feeling sick, he didn't think it was COVID-19.
I was tired, and I felt like I was kind of like riding a bicycle underwater.
He ended up in the hospital when he couldn't breathe. A scan of his lungs showed he had pneumonia caused by the virus.
And it definitely makes me feel blessed that, you know, at an almost 50-year-old man, I'm in good health and was able to, you know, minimize my stay to 3 days versus, you know, 1 month, 2 months. There was a gentleman there I know that they said had been there for, he was pushing 6-7 months.
So we're still seeing plenty of really sick folks, still having patients that are dying routinely from COVID. So we have not won this war by any stretch yet.
Dr. David BASEL says the drop in hospitalization numbers in early March may have lured people into a false sense of security.
Then kind of a combination of variants coming into the community, as well as, you know, temperatures getting a little bit warmer, people deciding that we'd won the war and start being a little bit less interested in masking and social distancing. We've seen those numbers rise pretty substantially since early March.
COVID-19 hospital patients are now running on average 7 years younger. Avera says only a couple admitted to the COVID-19 wing were fully vaccinated. About 10 to 20% of hospital patients had just one dose.
But it's the unvaccinated population that's getting admitted and having these issues. And so until we can get those vaccinations, we're not going to be able to fully open back up and put this in our rearview mirror.
I got the text message to be vaccinated 2 days before I went in, which is ironic in that aspect.
While catching COVID-19 may provide Oakes with immunity for a time, he's still planning to get the vaccine so he doesn't have to go through anything like this again.
My grandmother was a polio survivor. I'm a firm believer in vaccinations.
Avera says it hasn't had a single person hospitalized for complications due to the vaccine, showing that it is not only is it effective, also it's safe.